Thank you for taking a few minutes to watch this Care Transitions video. This is a crucial time for you to become an activated patient. By following the basic steps introduced in the video, you can continue your recovery, maintain good communications with your healthcare team, and avoid having to leave your home and go back to the hospital. Remember, you are an essential part of your healthcare team. Each of us returning home from a stay in the hospital is unique, but many of our homecoming experiences are similar.
You're excited to be coming home, but there's a whole new level of responsibilities to be thinking about.
Somebody has to take charge, and it will probably not be my husband, so I guess it will be me.
There's a lot of stuff to think about. Medications, treatments, appointments. It can get pretty confusing.
You take a lot of stuff for granted at home, but then when you're in recovery mode, it can be really different.
There are 4 stepping stones that can help you make an effective care transition. First, manage your medicines.
You got to manage your medications, and that starts in the hospital before you get discharged.
The hospital will provide you with a list of prescribed medications. You should go over these with a nurse and your family member or caregiver.
They call it reconciliation. It's where we take a list of the medications she was on before she went in the hospital and compare it with the medications she'll be on when she comes out of the hospital.
Even the vitamins and supplements that you take every day.
It turned out one of the medications Mom was on before she went into the hospital needed to be changed after she came out of the hospital.
A list of current and new medications should include the name of the drug, what it's for, when and how it's to be taken, and any potential side effects.
Write it down, and if you have any questions, call the nurse.
Think about managing your medicines. Keep a list of your discharge medications and know what they're for, as well as your previous medicines. Make sure to reconcile the 2 lists and go over potential interactions, reactions, and side effects. Your second stepping stone: monitor your condition at home. Know the red flags or warning signs to watch out for, and don't hesitate to call.
Another thing you need to be aware of before you head home from the hospital, they call them red flags, signs that could be complications.
In our case, there were 2 red flags we were supposed to watch out for: fever and swelling in her lower leg.
We had a great conversation with the nurse. She told us many of the symptoms we might say are normal, like weakness or tiredness.
My husband seemed to be in pretty good shape when we left the hospital, but I'm still concerned.
Again, making a list can help. Current conditions, what to watch out for, and what to do if it happens. Don't hesitate to call when you're concerned.
Just call the doctor for reassurance and information. You really want to avoid having to go back to the hospital if you can.
Think about monitoring your health condition and potential red flags. Identify potential red flags before your discharge and write them down. Write down a number to call if a condition worsens, even on nights and weekends. A third stepping stone: set up your follow-up care and begin a personal health record.
They call it being an activated patient or an activated caregiver.
Get on the phone. Make an appointment for your own doctor. He or she may not know you have been in the hospital.
A personal health record is a great tool for scheduling and organizing.
You can note down your emergency information, your family history, insurance information, even living will and a power of attorney.
It helps with the communication with all the different people involved, like the pharmacists, the therapists, the insurance people, volunteers.
However you organize it, make sure it works for you personally. It's got to be useful.
Think about setting up your follow-up care and beginning a personal health record. Be sure to contact your primary care physician for an appointment. Do it right away, even before you leave the hospital. Make sure you know the correct number to call. Write down key questions for your doctor ahead of time, and if you haven't already, begin your personal health record. A final stepping stone: practice home safety.
You know, we take a lot for granted about simply getting around.
Dealing with the stairs. We all of a sudden had to either carry her up the stairs or avoid them altogether.
For recovering patients, a safe and comfortable home environment can suddenly present difficulties. Identify places where you might need extra help, especially in the kitchen and the bathroom. Beware of slipping and tripping hazards and new obstacles to getting around.
A lot of it's just common sense, like in the bathroom. There's slipping hazards, of course, but people also need help using the toilet or getting in the shower.
Just keep things uncluttered. I look for things that you might be able to slip on or trip over, and I move them out of the way.
Before you bring someone home from the hospital, you really need to check the environment that they're coming into. Make sure you don't need to set up the guest bedroom or make any other changes.
Think about how you can practice home safety. Make changes to your home environment or routines to make them safer. Be more aware of potential hazards in the home and arrange for some special help or assistance for mobility, care, and safety.
The statistics aren't very good. 1 out of 5 people have to go back into the hospital after they've been released.
And a lot of that has to do with failure to communicate or monitor the recovery or medications.
Keep in touch with your medical team. Don't be afraid to call them when you need them.
The 4 stepping stones introduced in this program can help you become a more activated patient who makes a healthy transition home. Managing your medications, monitoring your condition and watching out for red flags and warning signs, setting up follow-up care and a personal health record, and practicing home safety.